So to get us started, I would love you to, if you could just put your expectations in the chat box. What do you expect out of this seminar or the webinar? What you hope to, information that you hope to gather? Yeah, we'd just love to hear that. We'd just like to know what your expectations are. I'll read out some of them if you start typing into the chat, and we shall be able to pick some of those and read them out to everybody else. So let us know what you think, what your expectations are. Then in the next 2 minutes, we shall get started. Otherwise, thank you all of you for logging on time. Let's hear what your expectations are. Anyone in the chat box? Let's just write out and say, this is what I'm expecting to learn today. This is why I logged on, why I signed up. Grace, if you could just kindly type it out in the chat, we'll be able to pick it up. Okay. I don't know who UCDS is, but you say to understand how to do early detection. Yes, that shall be covered. Thank you so much, UCDS. You could also change your names, rename yourself so that we can be able to pick up the names better. Florence Chimba, you're the first to log on. Thank you so much, Florence, for keeping time. Awareness about the disease and how to cope. Fantastic. Rachel Kalmik and breast cancer, big keyword. Let's see if that can be answered. Thank you so much for those questions. Okay, Judy K says early detection and symptoms. Yes, we shall definitely discuss that. Okay, thank you guys. I appreciate the questions and what your expectations are. Grace Nakongo says to understand whether men suffer from breast cancer and what foods can be taken to avoid breast cancer or cancer in general. Good question, Grace. Rather good statement. We shall see how to answer that as well, and if I'll be able to meet that expectation. Thank you so much for typing in the chat box. Much appreciated. So let's get started so that we manage to manage our time very well. Once again, welcome. This is Aqua Wellness Spa bringing this webinar to you today. We're located at Skies Hotel, Naguru, and it's really our pleasure and privilege that you decided to join us this evening. Let's start with a word of prayer, and I shall pray as we get started. Let's humble ourselves where we are. Heavenly Father, we thank you for this evening. We thank you that this is the day that you have made, and we choose to rejoice and be glad in it. We thank you for this evening. We thank you for the idea of this webinar. We thank you for all the people who have tuned in and those who hope to tune in later, to join us later. Father, in the name of Jesus, we pray for a great discussion this evening. We pray that we shall be able to learn, live here encouraged. Cancer is such a big word, and everyone hears the word cancer. Fear enters into our hearts and anxiety. We pray, Lord Jesus, that instead you shall keep us calm. And above all, Lord, that we shall learn and not lose hope, but know that even those who may have contacted the disease, there is healing in your name. And so we thank you. We pray for the panelists who are here today, that they'll be also able to learn, and also as they share their experiences, as they share their journeys, that they'll give hope and inspire the people out there. And also as we talk about this, may we pray people get to know how best to prevent it, what to do, and live here more knowledgeable and knowing what to do with their lives. We thank you, Father. We've prayed all this in the mighty name of Jesus. Amen. Amen. Some more expectations. Mary Chiwumulo says, what are the chances of suffering from breast cancer if one of your relatives has suffered from it? Okay, we shall answer that. Do men struggle with breast cancer? That's from Viola. And Jacqueline Mukasa asks, effects of fasting on breast cancer. How to support people with breast cancer? That will definitely be answered, as we have somebody from a support organization that will answer your questions. Okay. I hope all my panelists are on board. Just let me say, Gertrude, are you with us? Could please turn on your camera. Dr. Patricia, are you with us? Hi, good to have you. Hello, Dr. Pat, good to see you. You're muted. Everson, are you there? Oh, fantastic. Hi. Thank you, ladies, for joining us today. I'm so excited about this evening, and I cannot wait for us to end the discussion and have a good time. Have a good time. Yes. So without further ado, I'm going to just run through um, the profiles of our panelists today. First is Gertrude Nachigude. Gertrude, if you could wave to the people so they know I'm talking about you. Gertrude, if you could wave to the people. There you are. Okay, just wave. Can you hear me, Gertrude? Oh, fantastic. So, ladies.
Oh, yes, I can hear you.
Okay, fantastic. Ladies and gentlemen on the call, that is Gertrude Nachigude. He works for UWAKASO. UWAKASO stands for Uganda Women's Cancer Organization, and she joins us today as a speaker. Gertrude herself is a breast cancer survivor of 16 years, and is therefore her and a couple of women formed what is UWAKASO today. She's had over 2 decades of experience in cancer advocacy and awareness. Gertrude has worked with global initiatives such as the Breast Health Global Initiatives, the European School of Oncology, and the American Association for Cancer Research. She also serves on the board as the board of director on the Uganda Cancer Institute. Her life's work is devoted to creating a better understanding of cancer in Uganda and ensuring timely, affordable, and high-quality treatment for all patients. Gertrude, you're very welcome to the webinar.
Thank you so much.
Welcome. Our next panelist is Dr. Patricia Arach. Patricia, if you could wave so people can know that's you. That's Dr. Pat. And Dr. Patricia, we are so honored to have you here today. She's a dedicated general surgeon at Mulago Referral Hospital. And Patricia has a vast experience in managing patients with breast cancer. And therefore, she will share valuable medical insights to guide and empower us in the fight against breast cancer. Patricia, welcome to the webinar. Okay. Patricia, welcome to the webinar. If you could unmute.
Thank you.
Okay, great. And last but definitely not least is Everson Wenje. Everson, if you could wave so people can know who you are. Thank you. Hi, dear. Thank you for joining us. So we are privileged to host Everson. She's a proud mother of 3 and a stage 4 breast cancer survivor of 4 years now. And she's one of the speakers here today. And why we love having survivors on these webinars is that her story is a testament to strength, resilience, and that you can actually beat the disease. So as we get into the webinar, our theme really is to early awareness or an early detection actually can save lives. Okay. So ladies, one of the encouragements we have as we start is that please go and have your breasts checked. It's no need of being scared. You're better off getting the all clear and living a life without stress and worry, okay? So as we get started, I want to invite first on I'll start with Everson. Everson, would like to start by deeply appreciating you for your courage to share your story with us. And thank you for joining us again today to raise awareness of breast cancer and also to inspire others and probably give them hope. Those who have lost hope, those who may have patients right now struggling with the disease, but you're here to give them hope and say it's actually possible to beat this cancer. So Everson, please unmute and just briefly tell us your story from detection until how the treatment went. Maybe let's start with detection. How did you detect it? How did you know that you had breast cancer? Over to you.
Thank you so much. Good evening, ladies and gentlemen. Thank you so much, Immaculate. Before I thank the Lord for a second chance, because if I had not really survived, I don't think I would have shared such stories. But I thank God. My detection, it was not to me. I was before I was a sales and marketing person. I was always in field. I was always driving left to right center. I would travel every time. So I started by feeling a small pain around this side, like between my chest, between my breasts, some pain. At first, I thought it was an effect of seat belts. Later, they thought maybe because the nature of my neck, they thought maybe I was developing some goiter. We did the test, there was nothing. So one day, it was a Sunday, but before that Sunday, I would feel fatigued. From work, I feel so much fatigued. When I'm in field, I feel so fatigued. In the evening, I have some fevers. For ladies, of course, I thought maybe I was pregnant or something. But one Sunday, after my general cleaning at home, I was resting on my bed. So somehow, somewhere, I felt like feeling my breast, like testing them. On touching my left breast, I felt a very big and hard lump. It was not painful. So, of course, I would hear people talk about breast cancer, lumps in the breast. That was a Sunday. On Monday, I didn't manage to go for a test. You know how Mondays can be at work. So on Tuesday, I went to IHK. I requested to do that test, a full body checkup. They tested everything and everything was normal. But the doctor was like, we see you have high white blood cells. That means they're trying to defend or they're trying to attack a certain infection that we don't know. So he was like, maybe you can first be on antibiotics for some good time, then we see. Then before I take the antibiotics, I also felt a lump in my breast. So he recommended a scan, and on a scan, of course, it showed it was there was a lump, and it was going up to the armpit, the lymph nodes, what we call the lymph nodes. So by then, of course, we wouldn't tell whether that it was cancer or not cancerous. From there, they referred me to another doctor. Now, that doctor, the questions he was asking me that were clearly indicating that they're suspecting cancer. The questions were, do you have your mother? Said no. Did she die of cancer? I said no. Then he asked me any history of cancer, especially breast cancer in my family, which was a no. He asked me whether I was drinking or smoking. It was a no. He asked me whether I already have children. I already had 3 children. He asked me at what age did I have my first child. I had my first child at the age of 26. He asked me, for how long have I been breastfeeding my children? Of course, my firstborn was I breastfed him for 1.5 years. The second-born was 2 years, and the third-born was 2 years. So, but all those questions that were showing that they're suspecting something. To cut the story short, he recommended a mammogram that really showed there was a lump. And he suggested if we could do a biopsy. But at that time, I was into denial. I didn't want to jump into those conclusions. I ran away from IHK. I went to Novik Hospital. We did the same tests. Everything was the same results. I went to Kampala Hospital. The same. I went to Medipal International Hospital. Same, everything. So at that time, I was convinced to do a biopsy. So I went back to Kampala Hospital and did a biopsy. When the results came, of course, it showed that I had cancer of the breast. Yeah.
Okay, thank you so much, Emerson, for sharing that. I can imagine that even the reliving the memories of that diagnosis cannot be easy. But and so I really thank you for sharing openly, sharing that openly. So, what would you say that? What do you think that being diagnosed and getting to know, even after you went several times into to the different doctors hoping to get a different result, what was going through your mind emotionally? What were your thoughts, and what were you going through emotionally at that point in time?
When I felt I was so disappointed. Actually, I was very disappointed. I had a lot of mixed feelings. Like I was into denial. I would call it denial. I would deny. But again, somehow I would sit and say, maybe I have cancer. But whenever I would, based on the questions that I was asked, and every question was a no, I was denying. But somehow I felt I was disappointed. I felt maybe God didn't love me at all. I had so many questions. Why me? Maybe no, I'm not sick. No, it cannot be cancer. So I would say all in all, I was in denial. Like I was denying everything, but that was the bitter truth.
And I think for me, that's a natural reaction, even if it was me or anyone else. The first, like we said, cancer is such a big word, as they call it, the big C. Even just the mere hint that you could have it must send a lot of fear down anyone's spine. And also your heart must have been really difficult. It must have been difficult for you. But thank you that you're here today and you're here to share your story with somebody out there. And hopefully you'll probably give them hope. I want to call Gertrude in. Gertrude, if you could please turn on your camera and unmute. Gertrude, thank you so much for joining us today. I've worked with Owakaso for a very long time, so I know exactly what happens, but I would like to come in at this point in time and just share with us what is, first of all, let us know who you are. I just read a small summary of your bio, but I'm sure the ladies and gentlemen on the call would love to know who you are. So let us know who you are and what Owakaso does for, or can do for the people on the call today. Over to you, Gertrude.
Thank you so much, Immaculate, for the opportunity to be part of this webinar and this important conversation about the hard word cancer, especially breast cancer. Gertrude Nachigude. I'm a breast cancer survivor for 23 years. Actually, you said 16, but it is 23. I'm coming to 24 years. And I'm a co-founder of Uganda Women's Cancer Support Organization. Owakaso, in short, is an organization of women who survived all their fighting cancer. We work to support all cancer patients through counseling, home visits, online. We go to the communities, we go to hospitals to give them hope. This goes back to my diagnosis and the other ladies that were together. We never had anyone to counsel us. As Everson mentioned, that when you get a diagnosis, you go into denial, and you need someone who would understand you, who would give you hope. So at Wukaso, the patients that we support and they survive, help other patients we train them, we take them through training, and when they stabilize and they as navigators, so we go out to support the patients emotionally, giving them information, helping them plan for their treatment, understanding and how to deal with the side effects of the treatment.
Okay, thank you, Gertrude. Maybe you might want to tell us that you have enough.
I think also maybe what I need to also share with you. Yeah.
You're breaking up, so
sorry.
take off your camera so that we can hear you better.
Okay.
Okay, let's try that again. You're saying Wukaso?
Wukaso it's an NGO, and it has an office in Kamocha at the Holy Trinity Catholic Parish, but we go out in the communities where we are invited, and once a week we go to Uganda Cancer Institute to support the patients. We work with the navigation team and the social workers to help counsel these patients, answer their questions, encourage them to continue into care so that they don't disappear, because that denial is a real life experience. All patients go through denial and want not to continue to care, and in the process they get lost and don't complete treatment, and the end result is not good. So I'm happy to be here in this month and today.
Thank you so much. Thank you so much, Gertrude, and for that introduction of Wukaso. Ladies and gentlemen, if you're on this call, please keep writing your questions in the chat box, in the chat. We shall be able to pick them up and discuss them as we go along. So, Gertrude, thank you for what Wukaso does. I've been with you for a very long time, and I know that you've helped so many people with the counseling and support. What would you say? How does Wukaso provide families dealing with breast cancer, any other cancer? How do you support these how do you support families who may have a patient that is dealing with cancer?
When one gets a cancer diagnosis, the entire family breaks down. With my personal experience, at one time I coped and I felt I can move on, but my family, my sisters, my brothers, my mother, and the friends continue to be in denial, breaking down every time they look at you, they break down in tears. So what we do, on top of supporting the patients counseling, we do counsel families. And when we counsel families, we help them, first of all, plan for this patient. Also plan who is to be in the hospital, because cancer treatment is not done like it's over. So we help the family plan who will be in the hospital during surgery therapy, which takes over sedation, and the patient at home. We have seen some families leave or abandon patients in the hospital, not because they want to leave the patient alone, but they have also competing priorities. Now, if you're working, you have your full-time job and your mother is sick, you need to look for funds, but also you need to continue working and supporting the mother. So we really counsel the patient. We do family conferences because we realize the patients at times are alone, and when you have no family support, then you get depressed. So we help them plan their finances, help them plan their schedules for supporting the patients, and also creating awareness. Some families think cancer is contagious. They kind of discriminate a patient. You use your own plate, you use your own basin, you use your own cups. So we let them know that cancer is not contagious, and the person who is a patient needs maximum support whenever the person either is at home or in a hospital. That is what we do.
Fantastic. And I also know that you've shared your story before, but I'll allow you to also share your own story, Gertrude, such that also people may get to hear from another cancer survivor. So I also want to take you back. I should have said with that, take you back to detection. What you also, just like Everson, what did you go through? How did you come to the point of accepting? Because I know that it gets to a stage after denial where you have to get accepted. How are you brave enough to start treatment? In just like 2 minutes, just or 3, you can please share with us your story, Gertrude, as well, because I know it's quite an intriguing story which people might learn from as well.
Yeah, thank you so much, Immaculate. My story, I also didn't wake up in the morning to go and check. I was lying on my bed after a shower, and my hand just landed on my right breast, and I felt something hard closer to the armpit. And when I had it, it wasn't painful. It was a tiny, hard thing like a coffee bean. So I was sharing a house with my friend whom we had left the university together. And then she was like, no, never mind about that. That must be demonic. So I also left it. I didn't share it again with anyone, but I kept touching it. I kept feeling it. I had that small lump for almost a year. And when it became bigger, I just wanted this thing to be out. And that time, of course, nobody was talking about breast cancer. So it was something that I didn't have to worry about. So when I took it to the surgeon, he also removed it. He didn't even warn me that it would be cancer. And he told me, you come back and we dress the wound, because the biopsy cut was a bit deeper because it was in the gland. So when I went back, the surgeon saw me last. He said, I'll see you last because your issue is complex. And it was in the evening. So I was wondering why complex? So when he saw me like around 7, he told me, the thing will remove the heart cancer. So I wailed, I wept, I cried. So I made noise in that hospital. So when I first called my sister. She broke down and hung on me. I called my other friends. Everybody was hanging on me. So I had no way how to go home. So I stood on the road and started crying. But my friends and my family came in to support me. Everybody was like, no, they are lying. First of all, you're young. I was 28 years, so why bother about cancer? So we went to another hospital. So the doctor I saw there said, yeah, already I had no results, but only I had the words, you have cancer. I had run away from that first hospital and I never picked my documents. So they were asking me, bring the documents. So finally I collected my documents, and of course, cancer was confirmed. And when I asked what was the treatment, they told me it is mastectomy. Of course, the word was too strong for me, but later I learned it was removal of a breast. That also broke me down, because I didn't know how to live without a breast after mastectomy. And I wanted to see at least one survivor. I asked my surgeon, I want to see someone who has never lost a breast and she's alive. And I remember he sent me to a certain lady in Mukono who was a wife of a bishop, and she was very sick. So when I went there, I couldn't even see her, and at that time she died. So I knew I was heading for death. So I went for surgery without seeing anyone, without seeing how the scar would look like, without knowing what to do. So, but everybody from my family resisted, including my mother, that I shouldn't have mastectomy, because their worry was how will they cover the heart if they removed the breast. So I was expecting a big hole in my chest and the heart popping, but when after my surgery, I realized there was a nice scar, nicely covered, so that gave me hope. But what gave me hope is the support that I had from my family, from my employer. I had just got a job in Tanzania, and my supervisor and my colleagues and my friends were there for me. And that gave me hope, and they helped me to cope with the challenges that I faced along the way. So with that experience, without anybody supporting me, with the other 5 ladies, we had treatment together. We formed the organization 2 years later. So during the treatment, and then we didn't intend to have the organization at that time, but we wanted a support, that it's a peer support for each other. So we would meet for a cup of tea and share experience and cry together. And the 5 became 10, the 10 became 20, and that's how Castle came and it was born. So thank you so much.
Well, thank you so much for sharing your story. From what I'm picking up from both you and Everson, the issue of denial, which I think is very common, and I guess only human, I must say that, when you get bad news, the first thing you'd go to is in denial. So maybe Everson, I'll start with you, Everson. Everson, at what point did you start accepting your diagnosis and start medication? How was that journey from denial to acceptance? How did you transition from denial to acceptance?
Thank you so much, Immaculate. Now what I will first take you back. When they were doing biopsy, I didn't know that the doctor had pierced my nipple. So during the biopsy, they removed like 3 syringes from up, like around my chest up, around here, if you can see, around here. Then the third one, they pierced my nipple. Now I came back home, dressed. After removing the plaster, I didn't know that they had pierced my nipple. My sister went. At that time, there was a lot of confusion. My relatives were like, don't even go back to the hospital. Don't even think about Mulago. Do the herbs. So my sister had brought in a herb that I was supposed to take and then use to massage the breast that the lump would dissolve. So in the process of checking the breast to see how I should start massaging, it was hard. That's when I discovered my nipple had a hole. I would see inside. Actually, it was torn apart. I would see inside. Seeing inside, it was it was so scary. My sister left my bedroom. She was in the corridor. She cried. She called her husband. She called my husband. She called other relatives. She said, "You people, it is true. Everson has cancer." By that time, that's when we were waiting the 10 days that we were waiting for the biopsy results to come. So before they came in, because of that hole, I saw my nipple was wholly, it was torn apart. Already for me, I'd concluded that I had cancer. So I had concluded that I had cancer. When the results came, everyone feared to go and pick them. So I picked the courage. I remember I was in field. I went, I picked the results. I read on them that were showing that I had cancer. I put the results on the dashboard and continued work until I finished in the evening. So when I came back home, I remember at the gate when I was waiting for the gate man to open for me, I asked God, I said, God, if at all you wanted to give me a complex disease, why didn't you give me HIV? Why did you give me cancer? So I entered my room. I came direct, entered my room. I sat on my bed. I remember asking God, I said, God, I grew up as an orphan. Why would you allow my children to grow up as orphans? Because with cancer, for me, I was seeing death. Like I was really seeing death. I remember it was around 6 p.m. up to 9 p.m. I think maybe doctor will tell us what they call that, but even me up to now, I don't know. I don't know whether I slept. I don't know whether I collapsed. I don't know whether I blacked out. I don't know what really happened, but I sat on my bed from 6 p.m. to 9 p.m. in darkness. I don't know. You can't tell me what happened. I just remember the words. and that is it. Just to come back is when my husband had entered, found me seated in darkness, windows were open, children were sleeping in the house in the sitting room. They had not done homework. So when he asked what was really happening, I said, I have a lot on my head, and I gave him the results. So before the real result came, for me, I'd already taken it up that it is true, I have cancer. But now, that was around April. So with a lot of confusion from friends, from relatives, they said you shouldn't go for treatment. Because the whole treatment, everyone, they will talk about doing the mastectomy, what the cutting of the breast, and then starting on chemotherapy. So I did herbs, the whole of April, the whole of May, and then June. Now in June, that's when I went to a herbalist. He asked for the tests. When I gave him the tests, he canceled me. He said, "You girl, you're still young. You're very lucky that this cancer has not crossed into organs. Probably it was stage 2. So he said, before I give you my herbs, please go to Mulago Cancer Institute and start on chemotherapy." They cut the breast and start on chemotherapy. So that time I decided, like I sat and decided I would do herbs for a full month. If there's any change or decrease in the lump, I'll continue with the herbs. If there is no any size or it is increasing, I'll go to Cancer Institute. And that's what happened. In July, after taking all the herbs, I went for scan. The lump had multiplied. So I had to compose myself. I went to Mulago and did all the tests. Of course, it was cancer, and I started chemotherapy. I started on the treatment.
Wow. What a journey, Everson. Gertrude, again, because you're also a survivor, can we hear your story? How did you get from denial to acceptance and you starting to get onto treatments?
I didn't take a lot of time in denial. Actually, when I got the results from the biopsy that I had breast cancer, and I always heard the words of my surgeon, he said aggressive type. To me, I had spread. So I was thinking my cancer has spread. So we did all the consultations in town within 1 week. But because that thing was ringing in my mind that I have aggressive type of cancer, but to me it was ringing spread. And after my biopsy, my nipple was bleeding. So I was bleeding through the nipple. So every time I would look at myself bleeding, so I knew the whole body has cancer. So I wanted the breast off. And I remember we had a family meeting, and the family was like, we wait. Somebody had told us there is a herbalist somewhere. I said, I cannot wait seeing this blood. I cannot wait to when the cancer had already spread. To me, I had cancer has spread. So I got a surgeon, and then I was booked for surgery, and my family refused to take me. They said, no, we cannot be responsible for going to the hospital and you die there. So I called a special hire. He took me to hospital. So I was in the hospital alone. Of course, my family finally joined me. So there I had convinced myself to fight the disease, although my family was still in denial. But they came at night when I was already ready for the surgery. I remember one of my aunties came and wept in the hospital that, have you really decided to have that breast off? You may not come out of theater. So I cried the whole night. By the time I was going to theater, I was crying. But also what also gave me courage to fight on, because my biggest fear was, how will I cover the wound when they remove the breast? But 7 days after they removed the plasters, and I saw a line, a scar, and there was no heart popping, it was very dry. So I was so happy and I saw hope. So I started fighting. So that's how, but other people were still in denial. Have you decided? Why did you? So there was a lot of a blame game about my decision, but I'm happy that I took up that first decision. I have surgery quickly, immediately before even the wound was dry. I was already on chemotherapy. So my treatment was very aggressive and I was ready for it. Yeah. Back to you,
Yeah, thank
Immaculate.
you. Yes, yeah. Thank you so much, Gertrude, for sharing your story as well. Talking about treatment, one of the things that people, of course, that comes with chemo is the side effects of chemo. Everson, would you like to take us through your journey when you started treatment? What was it like for you?
Thank you so much, Immaculate. Now, once, of course, the way Gertrude was saying that there was blame game, there was also blame game on my side. My relatives were like, "You've decided to take that, but you're going to die soon. No one has gone to Mulago and come out. No one has gotten this surgery and come out." So by that time, also my cancer had spread. It had become so aggressive. Now, by the time I went to Mulago, I decided, me and my husband. So when I went, to me, my story was different because my cancer had spread to the lymph nodes. Me, I did not start with the surgery, but I started with chemotherapy. So by the time they wanted to take me through the counseling, how I'm going to lose hair, what, at that time, I had decided. So I said, I don't want any counseling, whatever goes, I don't care, but I want to do treatment. So I started on chemotherapy. However, during the chemotherapy, like the first 2 cycles, uh, I had no hope. At that time, I would see death. I would really see death. I changed the way of thinking. I stopped thinking for future. I was thinking for present, like if I've slept today, I don't know whether I'm going to wake up or not. If I've seen my children today, I don't think I'm going to see them tomorrow. So in that, because of that, I withdrew from whatever I was doing. However, I would continue work. I would go to work. Like that week after chemotherapy, I would go to work and do my responsibilities. But at home, I withdrew. I stopped being a mother. That now I was training my children, life after me, like life without their mother. I stopped helping them in homework. I stopped taking them to school. Of course, sometimes I would be very sick. I stopped all that motherly love completely. I organized my house, my bedroom. Like every time I would see death. I would plan for my funeral to see those ones who is going to cry more, who is going to mourn, who is going, like all that. That was it. That's what I was thinking about. I stopped maybe like serving my husband. If food is there, I don't care. So I withdrew from everything and got ready for death. Now, in that process of getting ready for death, that's how a thought came. It was like, now you've prepared. Of course, the body has already disappointed me. I'm on chemo and I know I'm going to die. But now the question was, have you prepared your soul? Have you prepared your spirit from now here? You've already seen this hell on earth that you have cancer. So where are you going after here? So that's when now I decided to come back to God. Now, through prayers, through worshiping, somehow I started getting hope, knowing God is above. And it's like, I'm going to make it, I'm going to survive. So that's how I started getting hope. No one, to me, I would not say no one came to counsel me. At that time, it was so unfortunate. I didn't know Gertrude. I was the very first person in my family to get cancer, and people would blame me, would say, "Now, can you imagine cancer? Like from where? How?" So it seemed to me, they saw me as a caste person, though. So I had no help. They were helping me, this other physical, I want this, I want that. But in terms of cancer counseling, I had no one to. So I had to counsel myself, take it in with God after preparing myself for death, and then preparing my soul and spirit for heaven. That's how God talked to me that I can make it. Actually, I cannot die, and I'm going to make it. And that time, that's when I got ready for any side effects like hair falling off. For me, instead of losing weight, actually, I gained a lot of weight. My eyes changed, my nails changed, my tongue changed. But at that time, I was really ready for anything. I had already got hope, but I did not get hope from any counselor, not anyone actually, but I got the hope from my God. In the name of preparing my soul to go to heaven, that's how God revealed that I can make it. Thank you so much.
Wow, amen to that. Ladies, this call may be terminated prematurely. However, if we do go off, please sign on back with the same registration, sign back on with the same link, and we shall be back on within no time. So if should we get cut off, kindly do log on back on with the link the Google Meet link that you are shared was that you used to log on to this meeting. Emerson, I see people clapping for you, love hearts. We're just trying to say that we are so proud of you. It is not, can definitely realize it's not an easy journey for anyone, but the fact that you and Gertrude pulled yourselves up by the straps and said, you know what, this is what it is. Let me get started. Yeah. And I think at this point, I would like to thank you people thank you so much for the flowers and hearts. I hope you're seeing them, Everson. People are supporting you. Same for you, the Gertrude for saying well done for that. And we are grateful that we have people who we know that can actually are strong enough to go through this journey. It's not easy. Maybe at this point, I would like to just bring in Dr. Patricia. Dr. Patricia, if you could unmute and share your screen, put on your camera, introduce yourself a little bit and tell us what you do at Mulago as a surgeon.
Yes, good evening, everyone. Good evening, Immaculate. Am I loud and clear?
Loud and clear, Pat. Dr. Pat, please go ahead.
Great. I applaud the ladies for their lovely stories that give us hope. I dare say they look very nice and very vibrant, and they give us, the feeling that there is hope even when you have late-stage cancer. My name is Arach Patricia. I'm a general surgeon working in Mulago National Referral Hospital. I work in a unit that deals with breast symptoms and endocrine symptoms as well. For the purposes of this talk, we see patients with breast complaints. We help diagnose them with cancer, and where need be, we also refer them to the oncologist so that they can start chemotherapy, either before or after the surgeries that we do. The breast disorders oftentimes are not cancer, and every so often could be cancer. And so we help them as a team, which is multidisciplinary, meaning we deal with the radiologists, the people that do the imaging, the oncologists, and ourselves, the surgeons. So that's what we do.
Thank you, Dr. Pat, and welcome to the webinar. I know you'll tell us later on about signs and symptoms, but one of the things the ladies said is that everyone was telling them the first thing they did was to go herbal. As a doctor, as a surgeon, what are your thoughts about that? Because like we see, as you know, people, as the ladies have shared, Gertrude and Everson, the first, when you get the diagnosis, the first thing is denial. And then depending on the support you get from your family, as you saw from Gertrude, everyone started to cry. All they saw was death. For Everson, she was in shock for 2 hours, sitting in the dark, not knowing what to do. And all their relatives and friends were of the view that, one, they shouldn't go to see doctors. They shouldn't have their breast cut off as they had been advised. They also were told, go herbal. As a medical doctor, what would you comment about on that be? Ladies and gentlemen, remember, should the link get cut, please, after 5 minutes, please log on again using the very same link that you used to get onto the webinar. Thank you. Over to you, Dr. Pat.
The reaction towards very bad news, denial is one of the first things up there. So the first thing you tell yourself is, it cannot be that I have breast cancer. You're in a state of so much shock. So that is a very normal reaction that they had to go through. And given the community and the love, their relatives, their closest people were going through this same reaction. They too were going through denial. I'm so happy, Immaculate, that you keep on every October trying to bring breast cancer awareness. And unfortunately for us, there are people that may not listen to this webinar today. So there are a lot of misconstrued ideas in our community about how to treat things. And we come from this African setting where the first thing is what maybe our forefathers used to do. Herbs have medicine, but we do not know exactly what type of medicine is in that herb. So we would rather go to the medicines that have been concentrated, tested, in order to know exactly how much is in that medicine as opposed to herbs. And so definitely it delayed the time that they had to come for treatment and to come for care. And that happens every so often, that in our population in Africa, we come for care for cancer when the stage is delayed and is late. And that heavily affects the outcome of the management. Someone asked, is cancer curable? Yes, it can be cured. But if you get it very early and you're able to manage it and take all of it out, you can get cured. As you noticed, today we're using the word survival. In the cancer world, they may call it remission. That we think you're at a stage which is latent, which is not active, so to speak. And so if we could come for care as early, if our communities could push us to come even earlier, because imagine all those messages that they are telling you are sinking into your mind. And a patient that has gotten very bad news does not have a lot of power to decide on their best route of action. So the messages they are receiving are the ones that they are going to go with. Yeah, that could be my submission.
And true. So our theme for this webinar is Act Now and Live Stronger. So one of the things that I take out from what you said, Dr. Pat, is that it's important that when you get diagnosis, it's important that you go very quickly to a medical facility and get started on treatment. Is that correct?
Very correct. Very correct.
What would be some of the things you'd encourage us to do, Dr. Pat? After diagnosis, because you see,
after diagnosis, so if you know that you have cancer, you're starting from someone knowing that they have gotten the diagnosis of cancer. Is that correct?
Yes, correct.
So if you get the diagnosis of cancer, it is a comprehensive diagnosis. As the ladies told us, they had pieces of tissue taken off from their breasts in order to confirm the diagnosis. That is one thing. The second one is how far has the cancer gone, which we call the stage of the cancer. I'm sure you've heard of an early stage and a late stage. And in the case of one of our speakers, they had stage 4 cancer, which is the latest stage. We go from 1, 2, 3, and 4. So in the process of diagnosis, they'll take off the tissues, they will do some scans of the breast, they may do a CT scan. Thankfully, these days, people have heard of those terminologies in order to see how far has the cancer gone. Now, these ladies presented to us 2 scenarios. In one scenario, they had to start with chemotherapy and then go for surgery. In another scenario, they had to start with surgery and then go for chemotherapy. Now, there is the treatment of cancer, there is also the psychological support for cancer. We cannot pretend that cancer is like malaria. It is not something you go in and we write a prescription and in a week you're fine. It is a diagnosis you carry with you, oftentimes for the rest of your life. Now, for you to comply to that medication, allow that medication, be able to live positively, you need a lot of psychotherapy, so to speak. In one case, you may be able to pray and get to a point of acceptance and positive living. Oftentimes, you may need a therapist, you may just need your friends and your family to look out for you. Now, in the therapy side, working in Mulago, so we have the mainstream hospital, we have the Uganda Cancer Institute, we have private cancer provision in this country. I'm sure we've heard of 3 Rivers. We also have oncologists that are actually working in private practice. The Cancer Institute also has a public section and a private section, given that it is one of the largest centers affording cancer care in the region. So people come in from just about everywhere, and oftentimes they are overwhelmed with patients. They're doing a great job. I commend them. And so if someone gets their diagnosis of breast cancer, it is of course imperative to come to cancer care, to come to the Cancer Institute. If you'd like the public services, they are offered free or at very subsidized costs where they need some cost sharing here and there. And I think we have a second Cancer Institute in Gulu. So the plan of the government is to roll them in different regions so that patients can have cancer care from different parts of the country.
Wow, thank you so much for that. We'll get back to the issue of physiotherapy. You said psychological support. Dr. Pat, maybe, of course, I'm going to keep going back and forth. The biggest question, which is one of them that is in the chat, is can you explain the common signs and symptoms that women should be aware of for the detection of breast cancer? And together with that, how often should one go for breast cancer checkups?
All right, thank you so much. So you said women, and there's a gentleman who asked as well whether men can also have breast cancer. Yes, men can also have breast cancer. They contribute less than 1% of the breast cancer cases. And so all of us are born with breasts, simply because women go through a stage where their breasts develop even more, and that is one of the drivers for breast cancer in women. And so men as well, if they get these symptoms, should be able to seek care. So the symptoms could include a mass is one of the most common complaints. It could be that your nipple looks a certain way that we call retracted nipple. Immaculate, do you have that image by any chance?
No, unfortunately, we didn't. We couldn't do it as. Yeah, sorry, unfortunately.
It's all right. So the nipple, which is the center part that is a bit that goes outward. I'm sure we all know the nipple. And some people actually are born with a nipple that does not go outward. And they get to realize they have a problem when they are trying to feed their babies. So the important thing is know what your breasts look like. Know what your breasts feel like. And so we recommend ladies 25 years and above every month, check your breast. There are so many videos online on how one should check their breast. You will then know what is normal and what is abnormal. And we've heard from the stories today that somehow they were having a bath and they felt something in their breast. But imagine if there had been a more intentional, examination of their breast. Many women that come to us are the ones that have realized that there is something wrong with their breast. So there's the mass, there's the nipple. Your breast can get a wound, which we call an ulcer. Thank you
Dr.
so much.
The image is up now.
Thank you so much. I got this from a document from the Uganda Cancer Institute. I don't know if it can be made bigger.
Yes.
By any chance. So we see on our far left, there is a normal breast, and then there's an image that is labeled dimpling, so the skin sort of pulls inward. And if you could see, there is even what appears to be dots in the skin. Then there's an image of a retracted nipple, unfortunately. Is the image even bigger, or it's just on my screen?
It can get bigger.
It can.
Okay, can it get bigger?
Thank you, Moses. It was getting bigger. Then, interestingly, some ladies have a breast that is bigger than the other. That's why I came at the beginning. I told you, you ought to know what your breasts look like, so that the day you stand in the mirror and you realize, hey, this was not bigger than the other one, or this, even if it was not, even if they were not exactly the same size, but you can tell that this time the size is a bit off. In the lower right corner, we have a mass, an obvious swelling that you can see, and in that same breast, the nipple is pulled inward, what we also call nipple retraction. Then in your armpits, so the breasts and the armpits are closely related, and oftentimes if someone feels something in their armpits, it could be because they have a problem in their breast. So we have a swelling in the armpit, and that could actually signify that someone has a breast problem. And then we have that breast ulceration picture that doesn't look very pretty. Sadly enough, we see so many such patients. Patients that have had a swelling that is not painful, and because it's not painful, they sit with it at home for a very long time and only come when it has become ulcerated and smelling, and that is usually late-stage disease. Now, of course, pain can also be a symptom of breast cancer. in all these things that I have mentioned, it does not mean that because you have pain equals breast cancer, or because you have a mass equals breast cancer. But it is a cue for you to then come to the health facility so that you can get an assessment by a clinician, most likely get an ultrasound or a mammogram done or an MRI done, and then we can decide on what to do next.
Wow, thank you. That is so elaborate. And of course, the diagrams are quite scary. But the good thing is that there is hope, and that's why we are doing this today, to create awareness such that ladies can know what to look for. Or if a friend tells them, like Gertrude told a friend that I'm feeling, and the friend told them, just forget about it, to go away. That awareness, get realize that if you find that something is not right, I think the good thing that God gave us was intuition. When you feel something is not right, please carry ahead, go and act on that feeling, intuition, and get checked. Dr. Pat, you said, how often should we get our breasts checked? And should we do our own personal checks on ourselves?
Yeah. So there is what we call a self breast exam, and we think every woman over 25 every month should at least feel her breast. You can decide to calendar it and say, today is my day of wellness and I'm going to check my breast. Awesome. Now, we have women that may be at a higher risk of breast cancer. Then we have people that are at an average risk. Simply because they are women and they're living their lives, they are at a risk of breast cancer, an average risk. So we have a recommendation of people doing what we call the mammogram. We had initially put it at 40 years, that 40 years and above, you should get a mammogram every year. The mammograms are there in Mulago, Kampala Imaging Center, and so many other imaging centers in this country are able to do a mammogram. As you grow older, maybe age 75 or 80, you can start doing it every other year. And then when it has been normal for so long, you can decide on whether you want to continue with the mammograms or you don't want to. Now, there are people whose risk of breast cancer is even increased, and they may have to do these tests even younger, maybe at age 35, age 30. Someone asked on whether a family member has had a diagnosis of breast cancer and how does that affect you. It also depends on how close they are in your bloodline. Are they your mother? Are they your sister? Those are the ones you call first-degree relatives. Then are they second degree? So the less the degree or the closer they are to you, most likely the more risk of breast cancer. And this usually happens because there are two types of breast cancer. There is one you get because the environment has affected you one way or the other. We've been asking questions on what food can you eat. For one reason or the other, we may have more chemicals that cause cancer in our society today than we had before. Then there is another type of breast cancer that you get because your parents and their parents may have been at increased risk of breast cancer because of your genes. And so if we try to see a pattern, and if you're able to do a blood check to show that you may have genes, materials in your body, the way your body is made up, that puts you even at more risk of getting breast cancer, then you may have to get more screening and more checkups for breast cancer. So it depends on how risky you are for breast cancer, but at the same time, where you are in life, how old are you, etc.
Okay, so, thank you so much, Dr. Pat. Someone is asking in the chat group, is the biopsy done when you are fully awake?
The person is fearing pain. So by fully awake, I imagine she means that you're conscious and
Conscious.
you're aware of what is
Yeah.
happening. But we have ways of reducing pain even if you're fully awake. I'm sure there are mothers that have given birth by cesarean section, but they were fully awake because there is medicine that was given to try and remove actually the pain where the doctors were working. So they can anesthetize, they can give medicine just around the area that they are going to work on in order to reduce your negative experience of the biopsy. So oftentimes we do it when patients are awake, but under what we call a local anesthetic.
Okay. I hope that has answered your question. Someone else is asking, Grace Nakungu, is there any link between wearing bras and the risk of developing breast cancer? There's always been that myth. And maybe also you want to debunk some of the myths out there which we've come across about breast cancer and how people get breast cancer.
Definitely no risk associated with the bras that you wear. However, we've seen patients getting breast diseases because they are allergic to a certain material of bras, in which case we ask them to get bras that have natural fibers, maybe silk, etc. But bras per se, there is no documented evidence that wearing a bra will increase your risk of cancer. It can instead lead to pain in your breasts if the bras are ill-fitting, can lead to allergies. We have people that get breast eczema, and they really need to be very careful about what kind of bras that they wear. Cancer per se in our African population, sometimes we think someone has gone and bewitched us, or we think there is some spiritual something that is related to it. And yet, as we stand right now, breast cancer is increasing so much in our society. It is, if you ask yourself if you know someone with breast cancer, most likely you do. And this was not the case when we were younger and we were growing. And unfortunately, in our country, it's actually killing people. It's the second leading cause of cancer-related deaths in women in Uganda. Only second to cervical cancer. So if someone is bewitching me, are they bewitching other people as well? Are they doing the same to other people? So it cannot be. The most likely our society has changed, or we are diagnosing things even more because we have more technology. One of the two things. Yes.
Ladies and gentlemen, remember the chat is open. Kindly post your questions there. At some point, we should also ask people to put up raise their hands to ask questions directly. But for now, kindly post your questions in the chat and we'll be able to pick them up and ask the panelists as we go along. Thank you so much for that information, Dr. Pat. It's been helpful. I want to go back to the ladies. I'll start with Everson. What did you do that helped you maintain hope and strength during your treatment? Everson?
Yes, please. Yes.
What did you do to help you maintain hope? What practices or what things did you do to help you maintain hope during the treatment and the whole process, the journey of treatment?
Number one, I listened to each and every advice the doctor would give me in terms of medication, in terms of diet, because there are some who really fast, that if you're on medication and then you make the cells fast, that they will die. But me, first of all, I would listen to whatever the doctor would tell me. I would take the medication, the medicines on time. Every time of chemotherapy, I'll make sure I go. Then another thing, of course, was God. I really prayed so much. I was so much into God. I believed, I had hope. So instead of crying, whenever that spirit of death would come, I would concentrate on living. Then on the other side, of course, I would read. Google was my friend. I just have to know that I needed more white blood cells, like more immunity. I needed to work on my immunity. So I would eat so well. I looked for balanced diet, especially the greens and vegetables for my immunity. Uh, then blood, because you see with chemotherapy, it kills all the cells and then you have to regenerate again. So I made sure I had my fruits like beetroot for blood. I will never run out of blood. Yeah, that was it. But mainly I was listening to every doctor's advice that they would tell me, and I would take my medication on time.
Fantastic.
Yes, maybe another thing I realized I kept on now, once you're sick, you have a lot of negative people. They will tell you such and such a person went for chemo, on the third one, he died. The other one, after the biopsy, she died. When you don't have hair, or you look horrible. So I kept on closing doors for the negative friends, for negative influencers. That's the time I landed on a person who connected me to the Fighters Group. Fighters Group is a cancer survivors group. It has over 300 women. So that's how, but I kept on now closing the doors for the negative people. Every time you would tell me how so and so died after the operation, that one I will not call you again. Yeah, so I closed all the doors for the negative people and I would look for the positive people. That is it. Those were the advisors. Actually, that's how I managed to finish my chemotherapy.
Very good. Wow, indeed, negativity is not needed at such a time. And
Mm,
it was brave of you to realize that and shut the negative voices out of your head since they are
mm.
not helping you at all. Gertrude, what was your experience? What practices did you do to help you get through this journey of from chemo throughout the whole journey of treatment, chemo, radiation, and etc.?
Thank you so much, Immaculate. Um, of course, I will start with the positive living. I developed a positive attitude, and I always want people who are positive I related with people who are positive, and they gave me courage. As Everson mentioned, of course, there were always those people who will always negatively comment. I've never forget an experience. The first day I came out and I went for a wedding, and you know that hot flash, the wedding was in a hall and I was sweating with a wig on the head. And the somebody to ask me, but why do you come on functions when you're still like that? Why don't you stay at home? Don't you see how you look? So, I mean, I felt so bad. I didn't enjoy the wedding. So I would close out negative people, and having a supportive group was very, very important. So when we started, the five of us would meet at Hotel Africana. It was used to be every Thursday. We meet and have a cup and go home when we are happy and rejuvenated. So having a supportive group with experience was very helpful. And of course, dieting. I watched what I eat and I ate healthy food and exercise, and became my very good friend. I would even call at night. My oncologist became my friends, and I always thought their advice on anything. You know, there are a lot of, I would go on Mr. Google and Mr. Google would confuse me. So I would relate, they told me, stop consulting Mr. Google. So I stopped consulting Google because this day will say this, another day will say that, and I'd be confused. But adhering and understanding your treatment and consulting your doctor is the best way to live. And of course, prayer, of course, trusting in God and pray and be happy and self care. Yeah.
I love that you said self-care at Aqua. That's what we're all about. And I would like to find out from you, Gertrude. What wellness you talked about self-care? What did self-care look like for you during this treatment? As you're going through the treatment and on your journey to recovery, what did it look like for you? What kind of
Um,
wellness practices did you do?
Post-cancer treatment comes with lots of physical, emotional, and social side effects. At times you have mood swings, you have sleep disorders, and also maybe you have extreme fatigue. Even going for a relaxation, go somewhere, relax and massage your body, relaxes the entire body. Then the moods, you feel your mood swings, you know. I mean, you feel you hate everything at home, you hate everything in your house, but when you're relaxed, you feel the body is rejuvenated. You can have your sleep again. And the extreme fatigue, when I was on hormonal treatment, I would get extremely tired even if I'm seated. So you need something that will rejuvenate your body to get out of that fatigue and then get more energy. And also in terms of self-care, it's the physical exercise. You can even have a walk, you can walk around your house when you are so weak, but when you gain energy, you can have a routine exercise, you can join aerobics. And because we realize self-care is very important and physical exercise, so we have started a signature event in October. We normally have a dance workout. And this October, on 31st, we have a dance workout. So we wanted the ladies to get that out, workout, have your physical exercise, fitness. That's how you can only manage your weight and also the mood swings and also the fatigue when you work out and have fun with the rest of the people that you love. So I invite all of you on 31st of October for the dance workout.
Thank you so much, Gertrude. We shall share the flyer on that. But if Betty is on the call, Betty, please share that flyer information in the chat group for the ladies to be able to pick it up. Dr. Patricia, support. Let's talk about support. What kind of support should cancer patients expect from their family, or what do you advise? How do you advise for support people going through the cancer journey?
Okay, thank you, Immaculate. It's a broad question. There has to be treatment support. Usually when people are going through these cycles of chemotherapy, as Gertrude mentioned, it's like their life changes, their appetite is really low, they are feeling weak, so much so that some people actually give up on chemotherapy. It is very strong type of treatment. It is not meant for the cells of your body, but because it has to kill the cancer cells, it will inadvertently affect the cells of your body as well. And so they just need people that keep them going, that keep them wanting to finish this cycle. That one of our speakers saying that she needed to take foods that help her replenish blood. We know that some of these treatments actually cause your blood cells and other cells in your body to reduce. And so your blood levels are low. So you have to put in even more effort in exactly what type of food you're eating. Now for the mood and for the for the positivity, there has to be intentionality in lighting up their life. In my opinion, that you cannot be going for cancer and then you come back home and everything is dull, your life is already going. So there has to be effort in order to help these people's lives at least appear much brighter. Psychotherapy comes in all forms, and I think it would help them a great deal.
Ladies, just be encouraged that the people in the chat are praising our survivors. Thank you for being brave, for sharing your story, that you both look amazing. And so that is why we're doing this. Okay, but, like people to think about hair loss, of course, the darkness that most patients get during chemo, the nails turning dark and hands turning dark, and therefore that's the fear that most people have of what will they look like as they go through chemo. But as you've seen, Gertrude and Everson, they look amazing, and really thank God they're here today to share their story with us. Gertrude, back on the issue of support, what does support look like with Uwakaso for both the patient and their family? Can you hear me?
Yes, I can. Support is such a wide topic, but at Uwakaso, the first support we give is counseling. Even the information on how to deal. Now, in breast cancer, the commonest question, how do you deal with loss of breast? And we have to show them our scars. As I mentioned, when they told me I was getting surgery, I was expecting my heart to be popping out and how in the heart, and even up to today, when somebody told you're going to lose a breast, they say, what are they going to use to cover the heart? So we take them through. If you've been recommended for a treatment, how will it affect me and how will I cope? How do I deal with the hair loss? We also provide navigation, how to navigate the Uganda Cancer Institute complexities. Go for the scan here, go up, run up, down. So we help them also navigate the system, but also they come for support for food. Some people live where they stay, thinking we come to Kampala for one day and go back, but people are here for months confirming the disease and they have nowhere to stay. They have no food to eat. So people come to us, and some people sell goats or cows or land to come for treatment, thinking it will be one journey. And then they will come back and they say, we need transport. We can't go back. So even we look for bus companies to give us pro bono or subsidized transport for some of the patients that come from our country. So we provide support as and from ranging from emotional to financial, to subsidize it, to ask it to, I mean, we normally engage Uganda Cancer Institute or radiologists to subsidize or reduce or to waive some of the investigation fees that patients cannot afford. Yeah.
Thank you so much, Gertrude, for that. Everson, what did support look like for you?
Of course, now for me, I haven't gone to that level of Gertrude because for me, I'm just an individual. I haven't even fought for all those years. But to me, at my, can I say my level or on my basis, how I'm supporting, one, I decided to come out and share my stories every time, every day. At the beginning of this year, I shared still my story with NTV. For those ones who can read news, yesterday I was in Daily Monitor still telling about my story. And then to a certain extent, whenever I have a plan to go to Mulago for reviews, I make sure I have some extra resources. Could be money, could be eats, could be fruits, knowing that I will find someone who will need some help. So I help especially those ones up in the tent. Sometimes I go with extra wigs because I know that those ones who have just finished and who have started chemotherapy and they don't have wigs or the hair hoods to cover, extra fruits, extra juice. But even during chemotherapy, we would make a group where, like, the day for chemotherapy, it was like, to me, like during the third, the fourth, it was like a party to me. So whenever I would be going, we would prepare a lot of food and we would make 5-liter jerrycan of juice. So would go with it, and you would find we would share, put music, and we would turn into the chemotherapy room into a party or something. We would laugh, we would, you know, that's the support to me, what I'm doing. But again, to everyone that is listening there, how do we need to support this? Love is very, very, very important. Positivity is very, very important. Caring, even though you just look at a person and say you're looking good, it's okay without hair. This wig is really, really good. It is enough for a survivor, for a patient to go an extra mile. So to me, those are the cares. That's how I care. Sharing. Sometimes I talk because some people call. Like we have this one has refused to go. So for me, I'm always very open to open my chest and show the scar and bring out my photos when I had bald head and my eyes were popping out. I'm like, you see, I used to be like this. I'm now like this. So always sharing my stories and inspiring. That is how I've managed to help those who are going through treatment, those who are feared, and those who cannot afford. Thank you very much.
People are clapping for you and Gertrude and saying, wow, ladies, thank you so much. Read some comments. Shamim says, thank you to brave ladies, Gertrude and Noe. We bless the Lord's name for your complete recovery. Thank you, Dr. Pat, for the knowledge you have shared, such great insight on the breast cancer journey and awareness. A big thank you to Aqua for raising raising awareness of breast cancer. You're welcome. Some other question, and maybe this will go to all three of you, but I'll start probably with Dr. Pat. How did you handle this? Oh, no, actually, let me start with the two ladies. Then Dr. Pat will come in to advise about the issue of stigma. Gertrude, how did you handle the issue of stigma that you experienced after your diagnosis and throughout your treatment because of the effects of chemo? How did you handle the stigma? Gertrude, and then we'll go to you, Everson. Gertrude, are you there? Okay, Everson, I see some people have dropped off. Everson, how did you handle the stigma when people got to know that you had breast cancer and you're doing chemo, going through chemo?
Thank you very much. Thank you very much. Actually, stigma, I would say, was one of the biggest challenges I got because news circulated even at my workplace. So a person would find you at your desk is like, Madam, we were told you have cancer. You're like, yes. Then they're like, what are you doing here? And sometimes I would compose myself, maybe like on Mondays, you put on your heels, you're struggling, and then someone meets in the corridor and is like, but for you who is already struggling, why would you bother yourself in heels? Or there was one that I was putting on, I used to wear my good expensive perfumes. So when one came out is like, we thought by the time you're sick, these perfumes would stop. I thought cancer patients are not supposed to use such. You see how people are stigmatizing you, like you're trying to bring out a different image, and these people are bringing in another image. You're talking, and then someone is like, I pity your husband. How is he going to stay with the wife without breasts? Or someone says automatically, actually, I remember one of my aunties one time said, I think we should sit as a family and look for another wife for your husband. So you imagine. But I thank the Lord that I put myself into a situation of saying, I've seen it all. And I was ready for anything. To the extent, even now, you go on a function and everyone is like, we were told you had cancer, you got cancer. You're like, yes. Then what are you doing here? Okachila, like, did you get cured? I'm like, you think I died? So are you speaking to a ghost? So to me, I decided to handle stigma in a direct way. The way you attack me is the way I answer, but the way I'm answering, I rubbish it off. I rubbish it off. I started spreading the gospel of saying cancer is not a death sentence. I started saying survivors can still look beautiful and normal. Actually, I started telling people that cancer survivors are more healthier than new people who are not yet sick. The fact that we monitor what we eat, we do unbalanced diet, we exercise regularly, we mind on what we put inside, we detoxify, we live like a happy, can I say, a health life. So to me, I tell them, actually, we are healthier than you people that think you're normal. And I always tell people to make sure that everyone is a cancer candidate, because you don't know how it comes, you don't know when it comes, and you don't invite it, it just comes. So for me, I handled it the way you ask. Any question that comes, I don't shy away. I just answer it back in a funny way. You say you're not supposed to smell like that. I'm like, so I'm supposed to smell like cow. So to me, that's how I've managed stigma. Yes, though some questions are very, very sensitive. Like I remember one time someone died of cancer and then I went for burial. One of the sons says, for you, you're lucky. Now I'm wondering why you didn't die. This one has died. It's like as if it was a competition for me and that person to die at the same time. Yes, really, yes. So and stigma has really affected, I would say it is the biggest challenge. And I would even say it is one of the reasons why I was stopped from work without any reasons. But every time any assignment, they will see as if you cannot do it until they say, leave us in peace. Thank you so much.
That is totally unfortunate, especially the last part of literally being pushed out of a job because they think you cannot handle. Yeah. Sorry about that, but I'm sure that is a legal thing that can be taken up if you're serious, because that is discrimination, absolutely discrimination. But I'm glad that that you embraced the journey and that you got to know how to respond to people who came with all manner of comments. I know most of this comes from a point of ignorance, people not know about the disease and the fact that actually if you are actually can live a positive life even when you're going through these treatments. Somebody asked in the comment section, how did treatment affect your work? But I think maybe you answered that. Someone asked, I think it was Emily. Let me find the question. Someone asked, how does treatment affect my everyday life and ability to work? Maybe Everson, would you share an experience in that regard? Gertrude, if you're back on, please let me know.
Thank you so much.
Okay, great.
Thank you so much. Yes. To me, during treatment, actually, I was working because I would go on Monday for checkups. I would get my chemo on Tuesday. Wednesday, I would work, and Thursday, I would work. Friday, I would be totally down, totally down, and Saturday and Sunday. Monday, I would go back to my work. So I would say my entire chemotherapy life, I was working. But later because I did surgery outside Uganda and then radiotherapy, that's the time I didn't work. But immediately I came back, I was given only 1 week of rest and I resumed my work. Though the fact is you cannot be as active as you used to be because you're weak, you're fatigued, you have those mood swings. The fact is you cannot work or you cannot be as productive as you used to be. But to me, I worked. It is later, after that, because of surgery, me initially I was left-handed, and the side that was sick was left. So because of surgery, they cut the nerves, the blood, the blood vessels. Somehow you become, can I use the word, incapacitated somehow, where even my handwriting changed. You cannot type for so long. But those are gradual. With time, you get used and you get well. Now me, I used to drive a manual car where you need to engage in the gears, and this leg couldn't do it. So I was changed into an automatic car. So of course things don't remain the same, but you work. Thank you so much.
Thank you so much, Everson. Gertrude, briefly, how did you handle stigma, and how were you able to work while you're under treatment?
Thank you so much, Immaculate. Stigma was a big issue, especially that time when there were so many, when many people didn't even know what was happening. I remember I was a cashier at that time where I was working, and the clients would always ask why my palms are so dark, didn't I wash properly? Then others would ask me why am I wearing a wig? In fact, one client named me Namlebe Tamazile, that you are a young girl, but why wearing wigs all the time? And I would always explain. And I remember I mentioned earlier that I was on a wedding, and somebody asked me why did I come on a wedding. So every time you would go out, somebody would make a comment. So, but I remained positive. I always saw the good side of me getting better. When I woke up in the morning and I feel better, I didn't mind what others commented about that. And also to deal with the stigma, I always shared my story. I think that time I shared my story, it was a Monitor publication. I, I remember I became pregnant during the treatment after chemotherapy, but during the hormonal treatment, the 5-year treatment, I was pregnant, and I was so happy. So, but when I went for antenatal, one of the doctors, who wasn't my doctor, said, "Are you not making a mistake getting pregnant?" So I broke down, because now coming from a medical person, it was heartbreaking. But my gynecologist was very good. And they said, look at your pregnancy as a gift, so don't cry again. So I shared my story that time, because I was tired of answering so many questions. So I shared my story, and that gave me courage, and that's how I broke through stigma and mobilizing the women. And since then, I've been open and out to educate the population. And when people ask me those questions, I actually educate them. And also, another bit that brings out stigma is loss of a breast. When we go out to sensitize the population, I went into one institution, and one man asked, "Are you not cold because you have one breast?" So I said, "No, I'm not. I'm a woman. I remain a woman. I'm a married woman, and I've had children after cancer." So I've dealt with the stigma by educating the people and how to, I mean, because they normally say or talk about such things because of misinformation or not being aware. So I always create awareness about what we go through, dealing with of course, working without a breast is very stigmatizing, and many women lose self-esteem. So maybe what I did share is we provide artificial breasts to women who have lost breasts to cancer, and these breasts are not readily available in this country. So we get good people like us who donate those breasts, but we always have challenges clearing them and coming through, those breasts coming through to the people who need them, and the special bras. because those ones are not available in the market and they are not. And the women really, to beat stigma, they need the breasts so that they can be women again.
You can look feminine again. Good enough. We have a couple of people from Uganda Revenue Authority here. You heard the cry of Wakaso. Clearing of these breasts is important. They play a big role to cancer survivors. For the women, as we know, women, breast is an identity as women. So losing them is quite a traumatic experience for them. And therefore, please, URA people on the call, kindly, when Gertrude approaches, can she be assisted in that way? As we're winding up, Dr. Pat, somebody asked, rather, let me ask you, what preventative measures should we protect against the risk of developing cancer?
Thank you, Immaculate. Just to add on what you asked Gertrude about the stigma, breast reconstruction is also available. And depending on your conversation with your oncologist, involvement of surgeons that are able to do reconstruction, women can actually have tissue or other implants put in and out of this country, depending on the circumstances. And so we really thank Wakaso for at least giving the feminine look. When you look at Gertrude, she has to tell you that she doesn't have a breast. But in the appearance, she looks very beautiful. And even with or without a breast, women are beautiful because their essence is beyond their physical capacity. But just to add that reconstruction is also possible depending on the circumstances of the patient. Preventative measures. So when we talked about the risk factors, there were those that you can't do anything about, like the fact that you're born into a family that has higher risk. There are people that have had radiation for certain cancers to their chest, all those things is there. There are those things we think you can do something about, but they may be difficult. It is thought that when women have children later, it increases their risk of breast cancer. And so if women could have children earlier, it would be a good thing. I term this not very easy to do something about because they are life choices that people actually have to make. If women do have children, it's a good thing that they breastfeed the children for as long as possible. It keeps them, we call it amenorrheic. That period when you don't get your period, you're actually not being exposed to some of the hormones, and so in a sense reducing. So if you did that more times, having more babies and breastfeeding them longer, but that is a personal choice that we cannot infer on every woman. We do know that taking alcohol in excessive amounts and smoking cigarettes can increase your risk of breast cancer. So if you can moderate your intake of alcohol, maybe a big wine glass a week or 2 cans of beer a week is good to go, not to take excessive amounts of these substances. Exercise. It has been said again and again. Walk a bit more brisk. If you can actually schedule it, even the better. Wherever you start, you can then work up to a schedule that can help you. We have also seen that keeping within a certain weight, and it gets harder when women are postmenopausal. And so it is very helpful for women in their later years to keep within a certain weight. We also know that the fat cells, as they grow older, actually are reservoirs for some of these hormones, or can help to produce some of these hormones that increase the risk of breast cancer. So keeping lean, keeping within a certain weight that is healthy is also key for breast cancer prevention. I feel like I am reading out a list. Breast cancer is driven by hormones, and so the more the hormones in your system, whether they are natural, and so we discourage prolonged hormonal contraceptives. The risk is relatively low. There is a risk of using contraceptive at the acquisition of breast cancer. Still a personal choice that I could not infer on any woman, and so using time can increase their risk.
Okay. Ladies and gentlemen on the call, thank you so much for tuning in. We have 2 minutes to the end of the call.
Immaculate?
Yes.
One more. Diet cannot be overemphasized. So if we can have healthy, diets and try to get that from the farm, so to speak, that are more natural, even the better. Reduce even the type of oil you use. Should be a more healthy option if you could afford, and if you can't, maybe you take it out. Yep.
All right, thank you so much, ladies. We have a dietitian on the call. We shall ask her to leave her contacts in the chat room. We shall also leave the call. We shall also share the contacts of Wakaso, contacts of Dr. Pat, contacts of Nelson, if anyone would like to talk to them a little bit more. That's also the contacts of Aqua Wellness Spa. Remember, this has been brought to you by Aqua Wellness Spa. As we run this month of October, we also have packages which you can be able to purchase for a survivor. Like Gertrude said, self-care massages are really good for our survivors, to rejuvenate them, to make them feel loved. So get in touch with us for those packages for survivors. We'll be happy to take care of them for you and help them to enhance their self-care. Otherwise, we thank you for the questions. We thank you for staying online until this time. We thank you for participating in this webinar. We hope to do more of these. This is an annual webinar we hold every year. We had one last year, it's the second one this year. We'll be hoping to have more people, panelists, more other panelists to join us to share their experiences and what we can do. But as you've heard, if you have family member, support them. Be positive, keep out of the negativity. Gertrude, also we shall share the contacts of Wakaso. If you have if you need group, I know what they also do is that they do group therapy for families, such that, as we know, a cancer patient doesn't suffer alone, even if the family members suffer along with them. So how to know how to support that person. If you have a friend who is a patient and needs counseling and support, Wakaso is there for you to be able to do that. I know that Dr. Pat mentioned Uganda Cancer Institute, and someone said that they thank them for what they do. Also can get a contact with Dr. Pat for more details on where to go exactly at Uganda Cancer Institute. But from all of us here from Aqua Wellness Spa and the team that has been in the background, we want to just say thank you so much for tuning in. Thank you for staying online. Thank you for your questions. We hope that this has been very helpful to you. Please share the word, the email that you say you used for us to get onto this link. We shall share the recording. Please share it with workmates, share it with friends. Let us spread awareness. As you've seen, the stigma is real. The pain is real for those people who are suffering because people don't understand the situation and make all manner of bad comments because out of ignorance, because they do not know. So spread the word about awareness. Today actually is the 14th of October. It is actually day for marking a breast cancer awareness day. So if you can get a pink ribbon, these are available at Wakaso. Buy them for your organization such that they can support the work that Wakaso does. URA, I thank you so much for the big team that signed on and registered for this training. As Gertrude had an ask from you, please help them to clear those breast as quickly as possible so that they can reach the people who need them urgently. Otherwise, for all organizations, please reach Gertrude, buy these pins. They're only about, I think, 5,000 or 10,000 Gertrude. Support Wakaso. They do an amazing, amazing job in the society. They are those unsung heroes that people do not know about. And that's why I always bring her on the call so that people can get to know they exist and what they do for our society. From all of us here at Aqua Wellness Spa, we say thank you. Again, we're located at Protea Skies Hotel. If you want to come by for spa treatments as well, please come through. We live in a very stressed world. Don't die alone. Come and we help you to unstress. Otherwise, we love you so much. Thank you for being here today and have a fantastic, fantastic evening.